All right, again, welcome everybody. Wednesday morning, 10 a.m. where I'm at. Hopefully everybody's having a great day so far. We're going to get rolling here with our presentation regarding Medicare Center and everything that's involved with Medicare Center and how it can help you this coming AEP. There's still some things that I'll explain further about Medicare Center that's available, not available. However, it's going to be a great place for you to be able to do your scope of appointments in advance, your enrollment in advance. There's some other added features to it, buying leads and all that fun stuff. We're going to go through that. So I've allotted myself 90 minutes for this, for questions and everything, to be able to go through there. So as we get going, please feel free to ask questions at any time throughout the chat. I'll take time to be able to look at those as we get going and answer those as we go. So feel free to ask at any time. But right now I want to start out with a quick question. Are you currently using MedicareCENTER's client relationship management or CRM feature already? A lot of no's already. Okay, and that's fine. We're going to go through that and show how that feature is going to help you go through that array, and which is fine for those people who are using it. Great, I have personally. It's pretty easy to use, and we'll go through that. Okay, perfect. All right, so getting in. If you've never used Medicare Center before, easy thing is you're going to just need to get started. All you need to do to register your account is your NPN number, your name, your email address, what phone number you want to be contacted at with that, and then you go ahead to submit that in. So once that is approved by me, an experiment failed earlier, I don't have access to that right now, but I'll take care of that eventually. But once you are able to log in, you create the account, you're going to come up, you're going to log in, and there's going to be your dashboard and everything that's going to be involved that you have here. Now, first off with this, and again, we had talked about utilizing the CRM or client relationship management with that. That is under your contacts. A real easy way to do this and to import this and start to use this. This is my one client that I've used on here. It's real simple to add clients in there individually, or you can do it in mass import. So to add someone new, if you just have somebody sitting at your desk and you want to add them, all you need, easy, name, birth date, address. The more information you collect, the easier it is going to be for you when doing the application later on. Primary contact information. Do they want phone numbers? Do they want email numbers? What's their Medicare beneficiary number? What are their effective dates? And then going from there. Then once that is created, it'll just pop up and it'll add into your current contacts. Now, for those of you who have been agents for a long time and you have larger books of business, an easy way to do this is to import them in a mass upload. All you have to do is import, hit the import button, and it gives you an idea then of a type of file. It can be an Excel spreadsheet or a CSV file. All you're going to need is a name, email, phone number, address, digit, what county, what stage that they're in, and any client notes that you have. An easy way to do this also is to click on this box here where it says drag and drop. Now I'm going to go through here. Where's my report that I want to use? Select the report that you wanted to use, add that in there. That has everything there. You can see all these people now has automatically gone in there. Everything that has a header, you can go ahead and hit choose columns that you're going to simply, again, what's required is email, phone number, and that's it for this portion here. But the more you put in here, the easier it is. So with these columns, this came through a little bit different than I anticipated. Okay, first names, we're going to drag this and pull that right into there. Last names, same, we're going to pull that right into there. The emails have already been uploaded in there. The addresses have already been loaded up in there as well. Oh, I didn't do this very well for phone numbers. Well, shoot. Way to go. All right, we're going to cancel that. We're going to put in a different one. No, hold on a second. We're going to go back. We're going to do this again because that didn't work very well. Poor presentation on my end. We'll use this one. Okay, same thing. Now it's got even more people in there. But again, automatically logged in, names, emails, phone numbers. Now I got to go back in here, find phone numbers, drag those in there, whatever postal code or county that's in there, zip code. If they have the counties, great. If not, a lot of the stuff is going to also be available when you download a book of business from the broker portals, whether it be Medica or Humana's, whatever it may be, Blue Cross, all that stuff is going to be in there. Then once you have those filled for whatever you want, just go ahead and hit import. It's going to import all those contacts. As you can tell, there's 109. It shows 109 in there. It's going through to make sure that everything's right now up to date. If you have any duplicate contacts, it'll have a big red boxing, unable to import this contact because of postal code wasn't listed with it. I'm not concerned about this. A lot of these are wrestlers in Prior Lake right now. But once you're ready to go with that, you're going to hit finish, and then you're going to see everything that was enlisted in here automatically downloaded. Nice thing is this, and I'll show you because not all these are complete, but I'll show you this with my contacts here. When you click on their name, and you're going to go into, this is their overview. Again, everything that you've done with this client, the details about this client, name, email, phone number, everything in there. You can still put all that stuff in there when you edit that. You can now go in, because they have your address in the zip code primarily, you can now go ahead and see the available plans for that prospect that you've created there. You can also go in and do scope of appointments. You have no scope of appointments for this one. Perfect, great. We can send one out. We want to send that via email or text. Again, it's going to depend on your client. Okay, now the new thing with this is the 48-hour rule. This has already been updated on there under the regulations. You can track the 48-hour waiting period on a scope of appointment being sent out currently. Now I will show you what this looks like when you do this. Okay, so I'll do it via email because it'd be a lot easier for me. Yeah, that's fine. You guys can see that in a second. Send it, because text message will take a little bit longer. I don't want to pull up my phone for that matter right now. So again, once you've sent that scope of appointment, there's an indication with that. So now I'll go in there. You guys can read all my emails. Okay. So now it's, we're going to show, it says, hey, look, agent has sent you, dear Rocco, agent has sent you a scope of appointment to fill out and sign. Just click on the link, complete the SOA. It's going to put you to a link, and it automatically goes into plan enroll, and I'll cover more of this a little bit later on there. And it's going to, again, go through exactly scope of appointment. What do you want to talk about today? Medicare Advantage, they can click or unclick any of these boxes that they want to discuss. Make sure everything is filled out. Do they have a power of attorney associated with that? Yes or no? By checking this box, I understand the scope of appointment form is a confirmation of the information. You're going to go ahead and hit submit. So then it's going to give it a, appreciate sending that in there. So then we can go back into MedicareCENTER. We're going to go back into the overview of that. We're going to go back in the scope of appointments. Now you can see when this has been refreshed, the scope of appointment is ready to go. You can see anything that they want to discuss. Perfect. Okay. Why can't I complete this? Oh, so again, I gotta have to wait 48 hours to complete the scope of appointment when they show up at 10:10. So when you do that, again, there's going to be no fudging on this as far as the 48-hour rule goes. And I know people are looking at ways around go about that. However, if you're doing it electronically, you will need to be able to wait. Now I'll have to wait a couple days to complete this form for my 14-year-old son. All right, questions on that right now? And if I'm going over this really fast, I apologize. Let's see, Paula, what if you don't have my client's email. Yeah, they'll still upload. Again, when you go into the import and we're going in here, if I do this one, okay, you're gonna need an email for electronic scope of appointment at somehow. There's not a way to go about that, because even if you go here to add new, you can still put in, for fast track purposes, okay, if I don't have an email here per se, but I have a phone number, whatnot, you can create this contact, but entry is a duplicate. Okay, that's fine. We're going to create that contact there, and it acts. So you can do it not in a mass upload, Paula, but you can create a contact for this individual, but just not on a mass upload. So that it'll get that red box. If you do it on a mass upload, it'll say we can't import this person because they don't have an email, kind of like the 2 people I had on mine. So good question with that. Okay, anybody else? Okay. All right, we're going to go back to our dashboard. Now we have all of our clients and everything there. Again, here's our task list. We have an SOA within our 48-hour rule that we need to worry about. Here's all our people that we have created recently. Okay, we can go over that at any time. And again, if we need to complete this SOA, we go to our task. It still tells us that we need to wait X number of days at specific time to be able to complete that. Okay. All right, another poll question real quick. Do you use MedicareCENTER for call recording? Give everybody just a little bit of time to answer this one. Threw a little interesting question, little answer in there just to see where it would be nice. Don't record my sales calls. That's perfect. Not the best option, however, I've never heard of an audit. All right, good. For those people who have, those people who don't, for those people who don't, nice thing to start showing you is how that makes sense. So if you haven't, or if you don't, when you're logged in, click on your name and you're going to go to your account. On your account is the information that you provided for registration, name, NPN, email, contact information. This phone number, this agent phone number right here, if you were to call this phone number, that is your dedicated MedicareCENTER call recorded phone number. And it acts kind of, oh, I am? I'm sorry. Thank you. Okay, thank you, Teresa. Sorry, going into this under your account, I'm gonna do this again. Going under your account, under your name, we'll pull up all your information that you provided as reference, your preferences, your agent phone number. This is that dedicated recorded phone number that people can call you on for those appointed sales calls starting October 1st through annual enrollment period that you need to record. This phone number acts like a third party and just connecting you to this phone number that you have dedicated that you want to connect. So if anybody were to call me at this phone number, any current client regarding information, it will get redirected to my desk phone that I'm using right now. It'll also go to my cell phone because I have RingCentral as an app on my phone. That any call, when it's prompted to, will automatically have the call script come up for that client while trying to reach you. That early on, it's indicating we do not sell all these plans and available. This call is being recorded and all that fun stuff comes with it. So that is how you are going to get that dedicated phone number for people to call. Now, granted, that information or that stuff has changed for this current year for 2024 sales versus what it has, where you have to record all those calls in process. That has changed, so you don't have to worry about that necessarily. Only the sales process throughout the annual enrollment period will you need to record those calls. My apologies. Okay. So that's where that information is going to come. You cannot change, this number cannot be changed unless you request that help, where if it's not area code where you necessarily office in. Now, granted, I know people have non-resident license area, or they may go someplace in the off season per se. This is going to be the area code in which you necessarily work in. So, Bonnie, I'll just pick on you for a little bit because you have Grand Forks, but then you also have Bemidji. But your primary number that you have set up in here is probably going to be a 701 area code based on where your office is and anybody else that has that. But it's individual and it's not something to be shared necessarily with an office, because anybody who has a contract with GoldenCare as an integrity partner company will have their own individual phone number for them. The only thing that can be changed is this number where you want it right here that I've highlighted dedicated to, whether it be an office phone number or if it's an cell phone number. Completely up to you on where you want those calls to go to. Questions on the call recording aspect before I go a little bit further? Okay, nope, good. Plan enroll, since we're right here. So plan enroll is something that's available. Let me get rid of this. So plan enroll, this agent website, this is essentially what plan enroll is. This is a personal URL that is dedicated for you. So if you were to copy this and we put this into a website, this is plan enroll. This is dedicated directly to you. As you can tell, again, I am available to contact. My license number is right there. My contact information is in the upper right-hand corner for people to call. Guess what you see there? That's that dedicated phone number calling in. I'll get to that in just 1 second. But plan enroll is nice because you can utilize this, attach it to any kind of message that you send out, and they can essentially enroll themselves. They can see plans, they can learn about Medicare, they can do training and different things like this, where they have different type of things. How do I avoid Medicare penalties if they're still wanting to work, and do different things like that. So there's a whole bunch of different things that they can look at on their own for them. But the nice thing is with plans, let's go back. Okay. This is obviously dedicated to them. You can put any zip code in here and go ahead. You can hit the contact information. You know, if you want to contact me, call now. And if we were to call this, let's do this. See if I can show this real quick. All right. Yeah, I know this. I don't know if I'm going to be able to talk to myself, but I'll just hang up. Anyway, if that comes through on my phone, maybe I'll be able to pull it up real quick, what it looks like. But it's going to come from a like Texas area because of where integrity marketing is. That's just to indicate to you necessarily that a call is coming in from MedicareCENTER to you. So it's somebody who is looking to have questions about enrolling or questions about Medicare, that you can help them out with that. So just keep that in mind. If you get a call from a Texas phone number that you don't know, it's more than likely from MedicareCENTER and someone calling you on your dedicated phone number. Okay. So going back to this, if we go into viewing the plans that are available. So right now, obviously, we have an effective date. We can't get into January just yet. Why? Because it's not October 1st. So once we're able to do that, we'll just do that now. There are a couple different things that they can do. They can get better results by going through that, or if they want to go, you know what, I just want to get into Medicare and see the plans. But if they can go to, they're just verifying the information. Where do you live? Do you want to put a pharmacy in there? You can always skip that. What's your primary care doctor, if they want to put that in there? Any prescriptions that they add in, if they can add in on their own. Do you receive benefits from Medicaid? Let's go from there. You can create a profile, sign in, whatever it may be, because they'll want to do that if they're going to continue on and look at something later if they want to come back to it. Getting back into here, now they have a look and they can see all the plans that are available. There are 25 Medicare Advantage plans available in this area code. Now again, getting back to this is something I'll show on MedicareCENTER as well. It's only the plans that are available that have been, it's hard, okay, how do I explain this? Plans that are available that you are contracted with that Integrity Marketing knows about. How about that? That are available through MedicareCENTER. So for me right now, it's Aetna, Humana, Medica, and United Healthcare. And I'll get into that a little bit more. Do I have appointments with other carriers? Of course I do, but they're not necessarily available through MedicareCENTER right now. If they want specific Medica ones, they can just click on the box and say, oh, those are Medica plans available. Fabulous. Okay, all that stuff is available there. They can look at the prescription drug plans. Okay, now again, this adds in Mutual of Omaha that's available through that. You can look and see if there are any special need plans. There are not going to be any plans available through MedicareCENTER for these type of plans right now. From what I understand is that they may be adding those in a little bit later. They may not. For the most part, especially like those prescription drug plans that are available, if we look at lowest, again, what's not showing here for Aetna is the low price one. Why? Because it's a non-commissionable plan. It's still available for you to sell. It's just non-commissionable, so it's not available through MedicareCENTER. They can see the plan details. They can enroll themselves. And guess what? You get the credit. Makes it easy. It's no different than doing it on MedicareCENTER. If they want to enroll, it's the same thing. They're putting their name. You have to put this as far as registration information and whatnot. And you're just your base statement of understanding, things like that. I won't go through that process right now because I don't need to enroll myself in a plan again today. But questions on plan enroll. It's a pretty simple thing. You can just, and again, if we go back to this area, if we copy this link and we tag that into an email, or if you tag that into a specific message to your clients, just put in there, here, take a look at this. This is my personal website to help you find plans that are available to you in your area. Go ahead, take a look. We can walk through these on a step-by-step process, or you can enroll yourself if you feel confident in that. It's a great way to go through that. Okay, getting back. Any other questions on plan enroll? Okay, go back to our dashboard. I just got the email that my son completed his SOA, by the way. How many minutes later? All right, so getting into this. Now, again, back onto your account. Go back to your account. There are a few different things that you can look at. Now, again, if those are people who have used this more recently, you may see something new. There's Medicare App 2024 that's available. Medicare App has gone away. Now it's Medicare App 2023. For any of those clients you're looking to enroll through Medicare App through the end of the year that are eligible for 2023 into December, or anybody who, for AEP, you're going to use Medicare App 2024. You have Medicare Link and CSG. So we'll just kind of skip to Medicare App 2024. Great. Okay. Oh, I don't have approval, I bet. I don't have approval for that yet. Okay. Anyway, Medicare App, we're just going to skip right into plans. If people have utilized this before, a little bit different as far as uploading clients into this. Unfortunately, you have to do it on a individual basis. You know, if we're creating profiles, things like that. Again, everything that's needed with here, zip code, name, any more information you put, the better. We go that, or you can just skip to the plans available. You can always do this later. Oops, yeah, close enough. We'll go ahead and shop. We're going to shop for our plans. Again, this is what's going to be available to us currently right now. Again, only the contracts that you have with GoldenCare that are available on MedicareCENTER. Here are preferences over on the far side here. Again, it's those same four: Aetna, Humana, Medica, and United Healthcare. Can you see those other plans that are available? Of course. Okay, you're just going to click on the Add Non-Licensed Plans, and that's going to pull up everything that's available in Hennepin County. Okay, there's your health partners, Humana, Blue Cross, UCare. Okay, I have all of those contracts. However, I cannot sell all those through MedicareCENTER currently. In the works with that. You can see the plan details, but you can't, you can compare those side by side, but you can't enroll them into that. So the nice thing is, if they're looking, say, at a $0 plan, you want to be able to compare these plans. You can compare up to 3 at the same time. I wish it was more, but it's not. Nice thing about Medicare app is that it will show the differences in yellow between the $0, again, with these specific $0 plans. What are the medical deductibles, maximum out of pockets, all that fun stuff that comes in when doing an appointment or sending this via email. This will all show up for them. Search for provider directories. They can add their prescriptions. I'll get into that in a second. Are there any other benefits that you can add? So again, with this Help Partners Adjourning the PACE plan, you can add a comprehensive dental plan on there for an additional $28.50 per month on that. If they want to enroll, you just got to simply add to the cart, and then it'll start the enrollment process depending on that. So when getting into preferences on Medicare app, real simple for the plan that you're looking at. What are they looking for? What type of coverage are they looking for? How healthy are they? What are their risk needs? What providers are they looking for and searching for the facility? The prescription ad part of this 2 different ways. You can do it line by line, or you can send them a link to access their mymedicare.gov account. Now, granted, they have to have that account set up prior in order to be able to give you access to that. But if they do, it gives you a list because they've already put their prescriptions in there, and it will automatically put on their profile those prescriptions, and then add that cost to the plans when you're comparing those side by side. You know, you can always put in pharmacies as well, as far as finding whatever pharmacy is close to them that they want to use or whatnot, but you don't have to necessarily do that. Go ahead and just skip those. So all those preferences then get saved on the plans, and that'll change all these estimated costs based on the effective date. You know, and changes when we get into 2024, those will all change, of course, but it'll show all those Medicare, it'll show the medications that are listed here side by side and the effective costs that will be on there. Any questions about Medicare app? I know I feel like I'm rifling through this pretty fast. Okay. Get rid of this. Get rid of that. Close Medicare app. Okay. Medicare link. Again, not used all that often, but it is a good quoting and enrollment tool as well. So if you want to go into there, you can create a customer profile. You can search your contacts. Again, you can add a new contact. First name is basically all you need. But again, the more information you provide, the easier it is to get a more accurate quote for that individual. But if you just want to go to a quote, again, through here, and I forgot to tell us on Medicare app, now you can send a scope of appointment as well. So if you want, depending on the type of profile, you can do an email, you can do a text to scope as well. It works the same in similar fashion to MedicareCENTER or Plan Enroll. Either way, it works a lot the same. Get an email notification saying, hey, John sent you an email scope of appointment. It's a little bit different for tracking on here versus MedicareCENTER, where the 48 rule applies on there versus that one. I haven't tested this just yet. They haven't said that on Medicare Link it's working the same way or not. It's just kind of a wait and see on that. Not many people utilize Medicare Link, I'll be honest. But you can. Oh, you had to use Medicare Link for Walmart last year? Okay. Janet, when will the 2024 information be available? So October 1st. So they've preloaded, again, if we go into Medicare app 2024, I don't know why this doesn't, let's see if we, yeah. So October 1st is when information is going to be available on all those plans. They're going to do a mass upload on Saturday night into Sunday to get all that stuff available for you, so you can start sharing that with clients on there, Janet. Okay, so again, if we want to look up, we just go to the zip code here. You can put the Medicare information, everything, date of birth, that's necessarily required, but you don't have to, because over on the right-hand side, you can just go to view all plans. This is a little bit different as far as showing what's available to you to sell or not. Again, you have your Medicare Advantage Part D, Medicare Advantage Part D. You can do Medicare supplement plans, just MA only plans, and special need plans if they're available to this. But again, it's not available, Medicaid level is not available in this state, or look up, so be it. I'll get to the questions here real quick with that. But again, there's more available on here. Again, Alina, who's it? Aware, Integrate, I don't know who that is even. Health Partners, Humana, Medica, UCare, United Healthcare, those are all there. If I want to see, again, those are my appointed plans. If I want to see anything else, we're just going to unclick that box, and that's going to show everything Advantage. Medica's whole year, but I'm not. This is showing me not available to sell Medica through Medicare Link. I don't know why. It's one of the first contracts I had. But everything else is there that you can do that. The nice thing about using the Medicare Link, it's a really good comparison tool to do that. Even if you can even compare, get out of here. You can compare the ones you're not licensed to sell through here, but you notice on the bottom it shows up in a gray box. It's only going to be a big difference if you email these plan comparisons to everybody else with this button here, because if you click that, it only brings up the 2. If you compare them, it'll compare them all side by side. The nice thing about Medicare Link is that it is a very wide profile and gives a lot of good detail for what's available for a side-by-side comparison. It's not in a smaller box like it is on Medicare app. It's one drawback with Medicare app I see with that. But again, they can enroll in these plans right here when you send that to them. All that details are there, all the fine tuning when it comes to doing this for the summary of benefits, plus all those evidence of coverage, star ratings, and all that are required within a sales presentation. All that stuff is there for you with that. Let's see, Becca Joe. Oh, you use it, okay, perfect. I'm glad you use that. Enable it works well utilizing those wet signatures on that for SOA and stuff. Good. All right, Galen's asking if a customer calls on a regular phone number, do you give them your new dedicated phone number, have them call you back? Otherwise, how would you get that number? So a couple different ways you can do that, Galen. You can have them call you back, or if you can, based on your phone, you can then forward that phone call to your dedicated number. You can basically call yourself, and then you just forward it to that phone. Then it'll just kind of come in on your phone with that, and it'll start recording once you do that. So there's a way to. The easiest way is to have them call you back. The more complicated way is to transfer that phone call. If you have, say you have a VoIP system like we do here, and you can transfer that call to a different phone number, you can then transfer that call to that dedicated Medicare line. A little bit confusing doing it that way, but that's how you do that. When last year, what we did so with marketing aspects is what we did for people is to change the phone number, contact phone number on your business cards or maybe to that Medicare line. And then they can contact you and all those calls are recorded. Now the aspect is, what if they call you and they just want to say hello and things like that? You don't have to worry about that type of stuff anymore. But that was the idea of call recording personal phone calls and things like that. Well, if they call your cell phone, unless they call a dedicated line, that's not going to get recorded anyway. So up to you on how you want to do that as far as getting those calls recorded, to have them call you back at a specific number, because again, relegations tell you need to have those recorded during AEP in the sales process. Otherwise, you don't have to worry about it. Okay. Questions on Medicare Link? I know I'm kind of going through this relatively quick, and I'm not going over everything. A lot of times, trial and error. I've enrolled myself in a number of different times, which I'm surprised I haven't gotten a call from Medica yet, but the last application I did last week. So, okay. All right, CSG. CSG is a great tool to utilize. It's available to you because it gives you a lot of different products that are available to you. Medicare Advantage, Medicare Supplement. This is a great quoting tool that I use a lot of times for agents to help get quotes. Medicare Advantage, but there's also hospital indemnity, dental and vision, final expense. You can do all the same thing where you have a client manager. You can add clients in different things like that. But this is an area when we're not in AEP, or unless you already got someone else that you can necessarily enroll the rest of the year, but you can do fun things with this to sell other products throughout the year through Medicare, through CSG. So essentially, if we're utilizing this, it doesn't come across as far as the Medicare Advantage very well. But if we're just doing, oops, here we're looking at Medicare Advantage for effective year 2024, obviously is not still on there. Right now, we're going to not show prescription drugs to be able to get our quotes. So it comes across a little bit different with this. Showing available, what can we enroll in? Well, we can enroll in Aetna, we can enroll in Humana, but not United Healthcare or anything else that's available or anything like that. However, if we want to, if we want to compare these, again, we're just going to click on these here. Boom, boom, boom. You can compare up to 5, which is the nice thing on about CSG is you can compare up to 5 different products within the same one, obviously, to kind of give you a side-by-side comparison. If they really don't know, I don't know what zero plan is going to be the best one for me. Well, here are 5 different ones for you. And you can go ahead and kind of give those comparisons with that, okay? Oops. The nice thing also with this is, what if they want a $0 plan and they want to be able to have a little bit better hospital coverage? Well, the nice thing is we can fill the gaps with a hospital indemnity plan through CSG. And now it'll talk about the different types that are available. How much is it going to cost per day when you're in the hospital? What's your plan premium on top of that? So if the $0 plan, if they want better hospital coverage per se, you can just select one and we'll add that to the comparison. And then it just changes the benefits that are on there with the hospital plan that you necessarily may not have with on top of that. So it's a nice feature to be able to have that, to be able to, I don't know, for lack of a better term, make a little bit more money, right? Because you get your MA, but then you get your hospital indemnity commissions on top of that. So that's kind of a nice thing that you can do with CSG, is fill in those gaps that way. I'm just going to go back here. Oops. Again, Medicare supplements the same way in doing quotes here, depending on the state that you live in, if you have the alphabet soup versus us here in Minnesota, 2 different plans. Okay, doing the age, are they tobacco user or not? Basic, extended basic. Is a household discount going to be applied based on the carrier and things like that? What effective date are we going to have for MedSup? And we're going to just kind of go in for there. Again, the nice thing is you can quote up to 5 different ones at the same time so they can see what's available. Now with this, in Minnesota, there are 3 companies that we can currently enroll online. Allstate, Continental Life, and Lumico. Okay, but every other one you can just kind of do quotes with. Okay, here's our current age 65 female non-tobacco user extended basic. Currently, UCare has the lowest price. Then you can go into different types of comparisons with all that fun stuff with there. Okay, no different if you were to go into North Dakota, South Dakota, Wisconsin, wherever it may be, you can also do that, all that stuff and get all those changes. Well, Wisconsin's similar to Minnesota as far as MedSups go. Okay, but again, the nice thing about CSG, you have a additional thing. If you have someone who's just looking for dental and vision, you can do that for them. If they want to maybe just get final expense, you can do that with them. The document locker, that necessarily has all the plan details available to you. You can just create that and be able to upload documents, make it easier to send to people and kind of go from there. Whoops, I don't want that. Let's go back. Market Edge is something that's unique with CSG. Going not too crazy into this. I'm gonna go Minnesota. Oops. We're gonna look at all zip codes. This is for Medicare supplement stuff, by the way. Extended basic plans. What ages do we want to have this for? We'll just go age 65 to 70. Tobacco users, non-tobacco users, genders. What is our quote date range? We'll just use this next month. And now what we're going to do is we're going to run a search and we're going to view this stuff on a map. Because this will give you insight to enrollments. No, this is probably stuff that's getting deep into the weeds. Okay, but necessarily looking at maps, you can see where certain things within Minnesota are a little bit more, depending on the areas where it's a little bit hotter than necessarily with other ones. So when you go into this area, kind of where we are, in the past month, there's been 207 MedSup quotes. There's a population over 65, people turning 65, 992 people turning 65 in the next month. You can see how many people have MedSups versus Medicare Advantages with that. If you view those details, they just pops that down here with that, so you necessarily have to see that. You can do that for different areas wherever you live. What is the advantages of having that? Well, you can, again, as those people get older with those MedSups, those prices get up and up and up, and then maybe they want to try and save some money, can convert those to an MA plan, be able to go from that. But it's a neat little tool to be able to kind of see those details of how many people are turning 65 in this area in the next month. It's 196. Brainerd area, there's 202. Okay, big Medicare Advantage area up there. We go further north, it's a little bit different, more MedSups versus MAs, a little bit quoting, not as many people turning 65, things like that. There's some quotes that are available, things so with that. So that's kind of a neat feature with a heat map as far as under Market Edge with CSG. Questions on CSG? Okay, enough of that then. Okay, let's see, MedicareCENTER. Let's go back into my contacts. Go with Zeke now. Enrollment, we're going to kind of go sidestep a little bit. We're going to go to available plans here at Medicare Center. We are working hard with other partnered companies within integrity marketing to try and get our ready to sell uploads to get as many plans available to you on here. Again, it only shows the availability of these 4 that are on here, right? We're working closely with other partners that we're trying to get Blue Cross uploaded. It's just a matter of time and being able to get the right file format to get it mapped out correctly to get it uploaded to sell. So trust me, when I say Medicare Center is going to be your one-stop shop, and as far as being able to roll people in, it will get there eventually. One of the things I did want to show you under account here is down here under your this is what's going to be available for your active selling permissions. Okay, so the odd thing is with this, it shows Minnesota, obviously my resident license, my non-resident license in North Dakota and Wisconsin. Doesn't show it for Medica. Why? Because Medica doesn't have copies of my North Dakota and Wisconsin licenses. It's in the process. I made sure to do that. But I can't sell a North Dakota plan or Wisconsin plan through Medicare Center currently, but I can through the broker portal. It just doesn't show that available. So if there is something that is missing on your active permissions on your account, let us know so we can make sure we get those licenses to those carriers, so then it will populate eventually. So right now, when we do things like this, it may take 2 weeks in order for those permissions to be able to show your ready to sell status on these type of websites. It's not an instant thing. Unfortunately, like when you get a text, you can instantly get somebody back. It doesn't work that way quite yet with Medicare Center on that. They work as best they can to get as many people contracted, because now when you look at the map of integrity marketing, there's like 100 companies, and think about the number of agents underneath that. So it takes a little bit of time. Okay. So eventually just double check that when you get in there, look at your permissions of what's available. If you're missing a carrier like Blue Cross, which I do have now, that's not going to be available because we just don't have that RTS report to upload to them. It doesn't show my UCare. It doesn't show some of the other carriers that I have as well. Okay. Lead Center. Okay, Lead Center is a newer thing that was incorporated last year. So this is something where you can go and get campaigns and purchase leads through this as well. And again, it went right through because I'm already logged in here, so it automatically logs into Lead Center. So there are different areas where we can look at to create leads for ourselves that you can purchase. Part of this to start off is you're going to click on your name, you're going to go to your account, all your contact information. Now this is where I had a snafu this morning. To add an organization, real simple. Once you get in your account, you're just going to click on this, and all you have to do is type in, why isn't GoldenCare on here? That was weird. Oh, because I already selected it. Well, anyway, this is just trying to do is make sure that your alignment, or where are these leads coming from for the FMO that you are aligned with. For GoldenCare, it's going to be under GoldenCare GCU, and you just select that, and then it'll say pending approval. Well, who gets those approvals? I do. And who snafu'd and got rid of all their admin capabilities earlier this morning? Yeah, this guy. So I can't even approve myself right now, or anybody else that's trying to do that currently. So FYI, I'm working on getting that back, by the way. But again, on here, you can look to see as far as references. Do you want to get lead sources from life, health? Turn those on or off. Plan enroll, make sure that is on. You can have that as well. Forward any check-in calls, you can forward that to the number that you have dedicated on your account. This is your Medicare Center account, things like that. Okay, here's your recorded call script. Okay, this will get updated to the current one eventually. Now it's a little bit different for each person because it should automatically have that for you, from what I understand, is have that call script changed to make sure that it says that. So it's going to have that capability of having it already. Okay. The other part is your wallet. Now here's where you're going to be able to add a credit card in to pay for leads. That we'll get into those in a little bit. Okay, but you're going to need to have that, otherwise you don't have any cash available. Okay, so you're going to add whatever card, might be a company card, different things like that. But if you want to go ahead and get that squared away, great. You can go into order leads, and we're going to go, what type of leads do you want? Do you want life leads, or do you want health leads? So again, life products or health products. What category? Are we looking for internet or direct mail? It's going to come up with a map. You can select the state necessarily, and you can then select any county or go ahead and just click on any counties that you want to be able to have leads. Now, in Minnesota, there are no health direct mail leads because they would all filter here. If we went to internet leads, here's where it's a little bit different. Okay, the type of leads that are available, how many are there, how old are they, and how many leads are there. Getting into this, when it tells you the type of lead, it's going to say what that is. If you click on that, drop that caret right there. So a Diamond Medicare lead is any consumers that's requested an online quote from Medicare in the last 48 hours. Leads are exclusive, they're compliant and generated from different types of sites. There's 3 of those available at $25 a piece. If you were to purchase 3 of these leads, there wouldn't be any other leads available for anybody else to purchase. So it's a nice thing is that once you purchase those leads, they're your leads and you work them however you need to. Okay, that's the general Medicare one. These shared ones, okay, same type of thing. So it's a little bit different where you might be able to have another person, leads are shared or been sold more than once. So again, people are requesting information, but other people can buy those. That's the difference between a regular lead and a shared lead here. They're different programs. You can change to go to different states, look at different maps. So if we look at, again, if we're going to North Dakota, you can see Fargo is a little bit hotter than Grand Forks, Bismarck's hotter than Jamestown, different types of things. If you go zero in on the county itself, you can see how many leads are available and what those unit costs are with that. This is also going to be important, so it's a little bit different because I don't have that access for those people who are involved in the Walmart program. There'll be a separate thing up top for you to be able to go through and do that stuff to be able to get those leads that are coming in through that. More details to come on that because I don't have that stuff. But once you have that and you purchase those leads, on the left-hand side, you're going to be able to manage those leads that are available, anything that you have generated, what's available, life or health, and go from there. There are vouchers that are available that we can create for you based on that and be able to answer any of those questions that you have with that. Every now and then, integrity marketing will put out saying, hey, get so-and-so off these type of leads that are available whenever you want, and there are discount codes available as well. Again, don't have any custom ads created, whatnot, no campaigns. So if we want to create an ad campaign, we can do that. And there are different types of things where you can, here's your annual enrollment, annual notice of your ANOC postcard, right? Annual notice of change. All your clients should be getting those currently right now. You can buy these, you get for $730, you get 1,000 of those with your plan enroll information on those. There's a business reply card that you can do with plan enroll. Postcards, different things that you can purchase on here, that are available. But guess what? I can do those for you too. May not cost you as much. So if you want any of that stuff, we can do that, whatnot. But again, I don't have my admin over here because I made a mistake this morning. Anyway, I'll get that back and we'll be able to square all that stuff through there. Any questions on Lead Center? No? No? You guys know everything. I like it. All right, what else do I need to do about Medicare Center? Call recording we covered, Learning Center. So Learning Center area, there's a different types of, this is more reference for you. There's a training videos that you can watch on there. There's other scheduled Medicare Center trainings that were just posted on here from Anna Patrick. There's one on Plan Enroll and how to use that. That's old, obviously. Oh, she just posted a new one. I'm surprised she doesn't have it up here. But all those resources are there for you. Medicare training schedule, Medicare Center training schedule, tech guides, sales tips, working remotely, all these carrier guides and stuff that we have available to you depending on the carrier are all there on Medicare Center as well for necessarily for you if you want. If you ever run into an issue with Medicare Center, you can certainly reach out to me. You can also reach out to Medicare Center. The best thing, and I will tell you, is send an email. Do not call that phone number. They, one, will not answer it, two, and they won't call you back. I'll look at something here real quick. Okay. So, yeah, if you hit support at Medicare Center, someone will get back to you relatively quickly with it. They are being a little bit overrun right now with AEP just starting, so just kind of FYI with that. But it does create a ticket for you and someone will get back to you right away. If you need to escalate anything and it needs to be kind of run up the chat a little bit faster, please let me know and I will do that because I have some back channel people I can reach out to real quick and try and get that escalated for you, especially as we're coming up. And there's certain things we're doing for AEP. But again, they are extremely busy and keep that in mind that they may not get back to me as fast with that stuff. So. All right, let's see, what else am I missing here? That's about it. Oh yeah, oh man, forgot about this. Ask Integrity, brand new AI feature that's available to you. It's also available on the app, which, yeah, where is it? I'll pull this up too. But Ask Integrity is an AI aspect with it that you can just ask Integrity. You click on the button. Okay, John, how can I help you? You know, tell me about my client, give me a call summary for my client, and you can give me a summary of my contact. So if you want to tell me about, say you have an appointment coming up and you want to learn a little bit more about your client, because it's been a little bit since you've spoken with that person. Tell me more about your client, okay? Which client would you like to and talk about? Okay, with the clients that you're specifically looking for, doing that. Okay, and here's information. Pete 78, give his birth date, lives in Minnetonka. He's currently on the Medicare Advantage plan with Humana. That was effective January 1st. He has no providers with 2 prescriptions and doesn't have a pharmacy linked. Well, he's a veteran, so he gets all the stuff through his VA. But again, everything that you have on that information will be provided here. So then you can get a quick link and get contacted through, get all that information. I updated his address to make it more, I tried to do an experiment with downloading him from Vantage to get all of his more important information, but it just didn't work that well because I tried to show how we can do that. But it'll show you all the information that you've done, that application that was submitted, everything that we have there, the scope of appointments, anything that we have done, all that is going to be up there. It'll show you all that information in there. That's a new feature from there. That's Ask Integrity. It's also available on the app. I just got to log in real quick because it doesn't automatically log you in. Oops, if I can not fat finger this. Man, never remember what my password is, so bear with me here for a second. Here we go. Everybody, oh, I typed it wrong. You guys can use me. Log in with me. I'll take all your sales. Okay. All right. So again, there's your snapshot. I wish I had a better link to it, but hopefully everybody can see this okay. Everything there, whatnot. And again, Ask Integrity pops up there for you. Everybody see? Oh, she just talked to me. Medicare would like to access speech recognition. Okay, sure. Okay. So tell me about my client. Let's see. Tell me about my client, Peter Headland. No? Oh, look at that. See? Popped up right away. So it's a neat little feature to have on there to be able to kind of help view that information for your clients as you're going through. And you're working remotely. If it works on a tablet, works on whatever you necessarily need to, you can get from information saying, hey, this is what we did last time. We go from here. I see we're on this. Is there any other prescriptions we need to add on to your profile before we get going? Things like that. Do we need to change doctors or whatnot? So it's kind of nice. Any questions on Ask Integrity? Again, it's not like ChatGPT. You can ask it all a bunch of different stuff. It's only MedicareCENTER related, whatnot. All right. I know I went through a lot of this stuff really, really fast. Hopefully it wasn't too bad. If you do have any other individual questions, feel free to reach out to me at any time. And you guys can open. Here's my contact information right here on the left-hand side. Email me, call me, whatever you want. Don't call that number, but call me anytime, Monday through Friday. Again, Fridays we close at 1. And I'll be able to help you go through MedicareCENTER, answer any of those questions. If we want to look at marketing plans and different things like that, we can go and see what's going to work best for you as you guys go forward. I want to thank everybody for their time. Appreciate you being here today, learning a little bit more about MedicareCENTER. If anybody else has questions, feel free to reach out at any time. You guys are the best. We hope you all the best during AEP, that all your resources are available to you. We are getting supplies in. So if anybody does need supplies, they want to place an order, contact us here at GoldenCare. We'll get those out to you right away, and we'll kind of go from there. But for now, I want to thank everybody for being here today. And right now, wish you guys all the best for AEP, and good luck to you. Any questions, feel free to reach out. Thanks.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.